Yes, my name is Tamberly Conway, and I'm here to represent Phil today. He couldn't join us, unfortunately. He was really disappointed in that. And I have been working with Worx as one of their guides for about 6 months now. And so it's an honor to be here today to share with you a bit about this mindfulness-based forest therapy program and intervention to support individuals with substance abuse disorder. So a bit of background about Worx. I actually met Phil in 2018 when I was working at the U.S. Forest Service in Washington, D.C., and he had recently founded Worx, which is based in Maryland. They've actually begun to kind of spread their wings and establish opportunities in other states, looking to go national. And this is a wonderful organization that offers these evidence-based programs and opportunities to deliver forest therapy. There are many organizations and agencies that are bringing this work to the world. Also, there's so much research, academic processes, and even training programs that support moving forest therapy forward. This is not that. This is really an opportunity to bring the practice of nature therapy to individuals in a way that's very guided and easily understood. And it's a short training program that 20 different professionals who are on this Worx team are trained in order to bring this practice forward. This is also being supported to bring into a variety of audiences, such as corporations, individuals who are experiencing PTSD, and in hospitals and schools, and also elder care communities. But this one is focusing today on addiction treatment centers. So what is a Worx session? Well, I'll give you just a little taste. So I invite you everybody to stand up. It's good to shake it out a little bit anyway. And just breathing in. So I invite you to close your eyes and just breathing in through your nose, 4 counts, holding it at the top, and releasing through your mouth. And one more breath. Bringing that oxygen up and out, breathing out. And now imagining that you're standing in a pine forest. All of the different greens surrounding you. A gentle breeze that blows through the trees and hearing the boughs of the pine trees flow. And there's a little creek that runs next to you. And you can feel the mist arising from that creek, touching your cheek. And then it's fall, and you can feel the leaves touching you as they fall from up above, touching the earth. You open your eyes and notice a leaf on the ground, and it's a beautiful maple leaf. And you pick that leaf up. And you can place a worry, a trial, a tribulation on that leaf. And then even toss it right into the creek. And watch that worry flow away. And now you can open your eyes, just feeling refreshed and rejuvenated. And so that's a little taste of Worx. You can be seated, or you can remain standing as a forest of amazing humans if you want. But so this is, again, it's mindfulness based. Many of the individuals who are on this team, it's again a team of 20 individuals. Some of us are ANFT certified guides, others are mindfulness guides, others may be ecotherapy guides, and some are counselors, teachers, medical professionals who really just feel called to bring this practice forward to others, really helping people dive into nature connection. So it combines a variety of practices: mindfulness, forest bathing, meditation, and group discussion, being in circle, which is very common in the ANFT practice. And so as we just did, we were engaging our senses and diving into nature connection to be fully present in the present moment. And this shifts us from being in the doing mode to just the being mode, so being in the present moment. This is essentially focused upon this inpatient substance abuse disorder program, whereby this organization had an opportunity to touch 6 different facilities and conduct research at all of those facilities. There was an incredible champion who knew Phil in 2020 when everything around the world was the mandatory pause, and they didn't pause. They moved forward and they supported this illness recovery and reducing blood pressure and cortisol levels, also alleviating depression and anxiety symptoms of people who were experiencing these substance abuse disorders. So there's limited research around this. And so this is why Worx is so honored to have been a participant in bringing this work forward. The study evaluates the short-term effects of these outcomes linked to the recovery from substance abuse disorders. So does it support anxiety, depression, and substance abuse cravings decline? So those are the research questions. Is Worx going to support in this type of recovery? And are these therapies effective? Do they help these patients recover from long-term SUD recovery? So they employed a one-group post-test design to measure these attitudes towards nature, anxiety, depression, and substance abuse, substance cravings before and after a 90-minute Worx session. So following each session, each participant participated in a survey, and they assessed all of those elements to determine the effectiveness. So after a 1 to 2 hour guided immersion, combining all of these practices that Worx brings forward, this was an element of that methodology where they would engage in using all of their senses and with these intentional guided activities. They used descriptive and bivariate analyses using Stata 16, and there were 821 participants who were either inpatient or outpatient or actually extended care residential individuals in the treatment program from March 2020 to April 22. They had limited demographic data, but the results showed that the anxiety in these individuals reduced from a 1 to 5 scale by 1.5 points, and depression was also reduced, and even cravings. So those who had somewhat high to very high pre-session cravings showed significantly greater reduction in those cravings that went to very low or moderate. Even the high baseline cravings group averaged 1.4 reduction from the pre to post intervention. And the beauty of it is 89% felt more connected to nature. And so we believe that this is really an important aspect because they're bringing this home. They understand that this is a tool that they can use to bring not only to themselves, but to their family members, their loved ones, and then learning about all of this research that we're hearing about throughout this conference, because this is something that we also embed so that they understand how nature connection is supporting them in their recovery. So in conclusion, the average participant really reported that they were having reduced anxiety, depression, and all of these cravings post-session. And this is important because even the highest risk group that had the most cravings were reporting lower cravings after these sessions. And just the knowledge that, again, nature is everywhere. As Kathy Wolf has mentioned, looking for that nearby nature. And this is something that we can convey to individuals, that you don't have to go to a park or to a forest or to a national park. You can go just in your backyard. You can go on a stoop or on a balcony, anywhere, even inside. And during the mandatory pause in the world, COVID, we were guiding people and they were inside, next to a plant, next to a fish tank. And people started to understand that nearby nature. And oftentimes what happens is when people become connected, they love nature more and then they want to care for it. And so whenever they begin to nurture themselves and nurture nature, then it is a reciprocal aspect that happens. And so this is supporting Worx. These sessions are supporting these individuals equipping themselves with the tools that they need to cope and to expand outside of this norm in their lives. So our next steps, we're seeking grants to study the rigor and scope of youth engagement, and we have received some local and state level grants to support this initiative. We hope to engage in longitudinal study and research measuring the mental health, well-being, substance use outcomes, and also the biomarkers associated with these types of interventions. So you can take a picture of the QR code and you can connect with Phil. I also have cards here today, and I'll be here presenting a couple more times throughout the day. I forgot my cards in my bag, but I will get those for you. And we'd love to connect with you, let you learn more about Nature Works and how you might incorporate something similar, or let's go international. I'm all about it. And thank you so much for your time and attention and for all that each of you are bringing to the realm of forest therapy, from research, academia, practice, and research and policy. We're very grateful and just grateful for the opportunity to be here with you all. Thank you very much. And get your nature dose on, y'all. Okay.
Thank you very much. Really, really interesting presentation. And I have a question. Did I understand it correctly? Was it just one session, a 90-minute session?
Yes.
And that was enough?
No, it was over time.
Over time,
Yes,
several
yes.
times, 90
Right.
minutes. Okay. So one extra question from me before I let you guys in. Would you say in the, your friends say in the abstract that this is a complement to traditional treatment? Would you say that this is a treatment that is suitable for all? Or is there certain characteristics of people that it works better for?
I would venture to say it is suitable for all because we're using this treatment to meet the needs of a variety of audiences. This is something that we would like to do with those other audiences as well. So I definitely believe this is a type of treatment that is supportive of a wide range of audiences. Yes.
Super. And now you have the chance. We have several minutes to ask questions. 3. Does anyone have a microphone for the auditorium? We have a question over here.
Thank you for your very interesting themes. During 20 years, I have more questions in my mind because you have two themes combined: mindful, needs-based, and forest therapy. I think if you need the distinctive study, you have 3 studies. First, mindfulness-based forest therapy. The second is forest therapy. Third is mindfulness-based therapy. So, if you have any data, in that case, which one is more efficient?
I'm not aware of any data that has been collected among those 3 separate kind of modalities, but it is a good point if you're looking at, I think in forest therapy, especially in the relational forest therapy practice in which I am trained, I would consider that to be more of a mindfulness approach, and that it is very sensory. It's guiding people into invitations. They're very open and sensory. And so it's different than the forest therapy practice that's practiced here and maybe even in some other countries. So in my opinion, we're using different modalities. And so the practice that I particularly guide, I would still call it a mindfulness practice. However, it's forest therapy driven. So there are elements weaved in, but I can see the benefits of separating those out. Absolutely. And I will ask Phil. And if you give me your card, I'll make sure he gets back to you on that. Yes.
Tamberley, I'm wondering your thoughts about, after Kathy's talk earlier in this room, your thoughts about integrity as this becomes an explosive area of interest and entrepreneurial activities. What are your thoughts about integrity and self managing or self governing, as opposed to having outsiders come in and begin to attempt to govern this area?
I would appreciate the approach of being able to do so internally. And we have so many areas of potential opportunity. And again, different, say, modalities or different styles of practice. And so I know Kathy and I worked together on that presentation. And it is important that we professionalize the practice so that we can understand the values that arise from each of those. And because certifications are so very important, I know that I'm a certified forest therapy guide, and I know there are many, many people out there in the world who have no certification whatsoever. And so that's a difficult avenue, to pursue if it's not being recognized, a recognized practice. And so I definitely believe that we all need to come together to organize and I think she probably, again, I was in the other room presenting in the other room. I wasn't able to be here for Kathy's presentation, but it's like urban forestry or arboriculture, like they were several years ago. There was no real focused certification and practice, and now it is. Now it's a global certification. And so I do believe that we need to move into that vein so that it is being supported and being embraced by the healthcare community in different nations. I know some nations are embracing that, but the more that we can professionalize it, the better. Thank you for that question.
Minimum kind of time frame that somebody should have to be involved before they get certified? Because I don't really understand, but I think there's a wide range of what the time frames are to get certified from 1 year to 1 week, as I heard today, which I was blown away by. Yes, could you speak to that issue? You were also.
We have to round up, so short response.
Okay. No, I definitely believe there are issues internally to the practice because of the need to dive really deep in a certification program. I know here in Korea, it's a year, right? A year-long program, and the coursework is intensive. I know my training was 6 months, and very, very intensive. I'm not saying that, the shorter programs are not valuable and valid. Yet I think there needs to be a separation in some way, shape, or form of those particular certifications.
And Kimberly, if I understand it correctly, the next speaker is going to address something similar to this. So
How fabulous.
if I have read it correctly. So thank you very much, Kimberly, for your wonderful presentation.
Thank you.